For everyone who's on right now, just to introduce myself, my name is Dr. Kris. I am a small animal practitioner for the past 24 years. I've owned my own veterinary clinic for the past 20. I've been working with Earth Animal for the past year and a half doing product development and just generally being a veterinarian on staff for anything that might come up. Today's topic is going to be obviously the topic of the day, right? The COVID-19. We're going to talk about people safety. We're going to talk about pet safety, and we're going to go over some questions that were presented before, and then we'll also do some live questions from you guys. So I hope everybody, while we're waiting to get populated, just hope everybody is staying safe and sheltering in place and generally being well. So I hope everyone stays safe, and hopefully today can just give you a little information on how to do that and kind of the steps that I'm taking personally, what we're doing at the veterinary clinic, and kind of, my colleagues and my classmates across the country, as well as are in Connecticut, what the topic of discussion is. And it's this COVID-19. Now, just for those who don't know, the COVID-19 is not the name of the virus. The COVID-19 is the name of the disease, right? So it stands for Coronavirus Disease 19 after the year that they found it. There are several human coronaviruses as well as several pet coronaviruses. Dogs have their own coronaviruses. Cats have their own coronaviruses. And while there are zoonotic diseases out there, meaning diseases that do cross between animals and people, there are very few. A lot of viruses are very species specific. Okay. I think, one of the things that we had heard some early reports with this, that maybe they did over in Hong Kong, that they might have found some of this in a dog that was from a household that with people that had contracted the COVID-19. The current thought of the AVMA is that they're a little suspect on those results. They think it's possible they picked it up as they were going to get off the animal, and we'll get to all this. I think the first thing that we want to talk about for the safety of your pets is that the current thought right now from the AVMA, one of the things that as veterinarians we're doing is checking with the AVMA for all their updates, the AVMA, the CVMA, the Connecticut Veterinary Medical Association as well, and just anything that's coming out, because these things can change, obviously. But the current thought right now is that your pets can neither contract this disease, which means, to get it and become sick from it, nor can they get it and carry the virus and shed the virus. Okay. So as of right now, and all the current science that we're seeing is that our pets are not at risk themselves from this. Okay. And I think that's very important because, we had put out a graphic and some tips early on a week ago or so saying, what our recommendations were for when you go outside with your pet and things like dog parks and communal areas. And we had a little bit of pushback from some people about, our what we thought and we think is the most prudent thing, and I still do, is that we want people to practice social distancing, and that includes your pets. And the reason why is not for your pet safety, but you have to understand it's for your safety, right? We have a saying here that we're all earth animals, right? And it's true. We're all animals. And my theory, and at Earth Animal, if your dog is in close proximity to another person or another person's pet, then you are in close proximity. So we want people to really practice social distancing. And in doing that, we can, as a whole, we can have less people contract this, and it's ultimately less time we're all going to have to be sheltering in place, right? So the thought is, if you're out walking your pet, if you're out walking your dog, we want you to maintain that social distance. And so you've noticed that a number of dog parks, a number of parks and things have closed, and they don't want people bringing their pets if they are open because of that reason. If your pet is off leash or something, then they can come in contact with other people's pets, other people. And I want to go back to something very important. And that is that while pets cannot contract this disease, or while they don't appear that they can get the virus and then shed the virus, one of the things that we know about this virus is that, one, obviously it's very contagious, but the other thing we know about it is that it lives on surfaces, and they're still studying for how long, but we do know that it can live for some time on surfaces, right? And the other thing is we're all surfaces, So if someone came up and pet your dog, all right, and God forbid they had the virus or they didn't know they have it, and they're shedding it, and they touch your dog, well, that can, in theory, live on the dog for a while. So if you then went up and touched your dog, it would be no different than if you touched a doorknob or a keypad or any other surface. So what we're saying is better to err right now on the side of health and safety and really practice that social distancing when you're out in public. Again, if you're at home and you're practicing that social distancing, and you're not allowing your pet to be your dog outside to be pet by numerous people and things, then when you're at home, snuggle on your animals, kiss your animals, hang out with your animals. We're all doing it. I mean, I think one of the things that we're seeing is people are, being home are developing stronger bonds with their pets because they're home with them all the time. And I know at our house with our 3 dogs and 3 cats, we're spending, it's nice to spend a little bit more time with them right now, frankly, for me. So, but it's the public that, out in public that we have to worry about. You know, it's just right now, I think we all have to work. It's important that we all work together. And if we work together and we maintain social distancing, I think, again, that just leads to less people contracting this, and it leads to a shorter time that we're sheltered in place. And ultimately, it leads to all of us leading, happier, healthy lives. The other thing to this is, from a pet standpoint, is if you, God forbid, contract the virus, and again, like they're saying, the bulk of people that contract this will get through it and then go on and be healthy. But if you contract the virus and you get sick for a time, that's a time that you have to really focus on your own health and may not be able to take care of your pet as well. So I think ultimately it's very important for us to just be as hyper vigilant as possible. And that's something as a family that we are really practicing in my house. The other thing I want to talk about is 2 things. I want to talk about veterinarians right now and what we're doing as a whole. And I want to talk about our retail stores, our independent retail stores where you get your pet supplies and your food. Right now, at our retail site in Westport Earth Animal, we are open. We are deemed essential, okay, because we do provide food for your pet. These small retail stores provide food, okay? So what they've gone to is the bulk of the retail stores have gone to doing curbside pickup or delivery, like Earth Animal has done, so that you can continue to get your stream of food for your pets. You can continue to get things for them to stimulate them at home with, chew toys and play toys and things. I mean, I don't advocate to, obviously you can be in your backyard playing with your animal all you want. And I do encourage people to take this time to get out in their yard with their pet or go on walks while you're maintaining social distance. And it's a good time to increase that bond with your animal. So I really do implore people to continue to order through their small retailers, and in this tough times to really give them business, to have them thrive and continue to do business. I think that's very important. I think all of us shopping local right now, as much as we can for ourselves and our pets, is a big thing, and I implore people to do that. As far as veterinarians, what you'll notice, and likely, I was actually on a town hall meeting last night with the CVMA, and it seems like the vast majority, if not all, the veterinarians, at least in this area, have gone to a curbside kind of practice where what the Veterinary Medical Association has recommended is that we do not allow people into our buildings. We have to maintain as much social distance as we can. So what we're doing at my clinic and most clinics we are going outside. People are pulling up in our parking lot. We are going outside. They are coming out of their car with the animal. We are using our own lead. They are disconnecting their own leash from the animal, or they hand us a carrier with the cat. And then we are bringing them in for their exams and what they need, and then we're bringing them out to the people. So we're not having anybody but staff in the building. There are various level of people wearing gloves, wearing gowns, things like that. At our practice, what we're doing is we are vigorously disinfecting at all times between every patient, washing our hands constantly, limiting, obviously, the contact as much as we can with people, trying to maintain that social distance, and doing the best we can. And I think it's something that I also want to tell people to expect when they go to the veterinarian. And I think it's the more that we all pitch in and understand that these are really unprecedented times, right? These are times that this is something we've never faced. So I think it's key, again, that we work together. There's a reason why you go to your veterinarian. You trust them. You know that they have your pet's best interest, and your health best interest. So I think it's important that, and I can tell you from my standpoint at my clinic, people have been wonderful, understanding and on these processes, because again, we're changing things all the time, and these things may change. These things could change tomorrow. It's amazing how fast the information is coming out and how fast we're changing things. So we're just going to keep up on it, and we're just going to keep trying the information stream, from these national organizations down to the state organizations, down to the veterinarians, and out to the community. So. I would imagine that these things may change a little bit more before they're done, but as of right now, that's where we are. And I think it's important that we all really continue to work together and just understand that that is going to be the fastest way for us to achieve the goal, which is ultimately to have the least amount of people affected with this, and the faster resolution of this. All right. So, what I thought I'd do now is read from a couple of early submissions. Some people had some questions before the live stream, so we're going to do that. And then if anybody has any live questions to ask that stuff maybe we didn't cover, or any just to clarify anything, please feel free to put those forward. Okay. All right. Let's see. Question number 1. This is from Debbie off of Facebook. Question is, a person suspected of having the virus pet my dog. What can I do to clean my dog and keep myself safe? It's a good question. It's something that we talked about. First of all, we want to limit those interactions with people and your animals, and obviously yourself, as much as possible. But if something like that happens, and you're concerned about that, what you want to do is, and what most of my colleagues, I've been talking to my colleagues about this and how we would handle it. Obviously, a bath is probably the number one thing. You can always do a bath, wash them well with a pet shampoo that you have at home. And that's probably the best thing to do. Now, we all can't always do that for various reasons. So I would think what we're recommending is do not use any sort of chemical wipe, Lysol, anything like that. I had some people ask me those questions as well. That can make your pet sick. They can certainly groom themselves and then become sick. You don't want to do that. But what we're using is things like baby wipes or something. And just that's certainly better than nothing. But like I said, I think probably, a bath would be ideal if you can do it. So, again, it's practicing hypervigilance. That's what we want to do. We want to make sure that if we follow along with the recommendations, the less interactions we'll have. Okay. This is another question from Victoria, and it says, is it possible for dogs to be a carrier of the coronavirus? And if so, how do they become carriers? We did cover that earlier. I just want to state that again. I think that, honestly, there are labs out there in the U.S. that are testing animals, and so far with no results. The information that we have now, the most current science states that they cannot contract it, and they will not be carriers or shed the virus, other than topically, like we talked about, surfaces again, which we've covered. All right. If that changes at any point, and again, we're monitoring it all the time, then we will get that information out as soon as possible. But for right now, that's the most current science. Okay, let's see. Here's a question. This is a very interesting question and a scientific question from Nancy off of Facebook. Hi, Nancy. I have heard on the coronavirus series channel 121 that medication recently found to be helpful in treating feline FIP. For those of you who don't know, again, getting back to cats and dogs having their own coronaviruses, cats have their own coronavirus, which causes a very terrible disease called feline infectious peritonitis. And they've been working on trying, typically there's very few treatment options for it. And they've been working on different treatment options, antivirals, things like that for years. And so the rest of her question is that this may be something that they would think of for treating the human coronavirus. Have you heard this? And said that it's very possible that this may be that this is promising for cats. So I had not heard about this. I do know about some of the drugs that they are using. They don't have names yet. They just have numbers. One of the ones is GS 4415, which are these antivirals that really very scientific antivirals that actually stop replication of the virus. And Nancy, I did research on this as well in the human. I could not find where they were doing any trials for this with people, but I'm going to continue to look and certainly will then put that information out there. But it does show some promise in cats, as you said. So, I mean, it's an interesting concept for sure. Thank you for that question. That was a good question. Okay, let's see. Here's another question that we had. And this one states, I used to use a dog walking service to make sure my animal gets outside and moving. If that's the case, what are my chances of coming in contact with the virus? Well, again, what we want to do is and I know I've said it a million times, but the social distancing thing is important. And I think if you do have a dog walker, I think having that conversation with them as well and making sure that you're all on the same page. So if you're, so just the simple conversation that yes, when you're walking my animal, I would like that you continue to keep social distances. We don't want them to be in play groups with other people's pets right now. Go on, get their exercise, maintain your social distance. We don't want people petting them right now. And guys, again, remember, hopefully that this is just for a couple months of our lives, that we can do this. We can all be partners in this and just continue to work together. And this is going to shorten the time. And then we can open up the parks and we can all go outside and our pets can play together again. And I think the fastest way to get to that is just all working together. Right. So I think it's worth a conversation with them and just telling them, look, I want us to all be on the same page here. All right. All right, let's see. Okay, one more question from the previously submitted ones, and it's what should I do if I must leave my house, either being or sick or in the hospital things. Well, certainly what I would do is if you have family that your pet can shelter in place with, that would be ideal. You can also use pet sitters if they're going to be alone. I think you have to, obviously the questions, if they're coming into your house would be, have you been exposed? Are you currently, have you had this? Or do you know anybody that you've been exposed? Have you been practicing social distancing? And, I think you just ask as many questions as you can. I think one of the things that kind of goes back to this is if we're doing our best to shelter in place, then we're lowering our chance of getting it to begin with. And that went back to my, these are all these measures are with the human health in mind. But at the same time, like I said, there is a trickle down effect and other things that can happen if you end up being in the hospital with things and you have pets and you may live alone or something else. So I think it just adds to the importance of all of us trying to do our part, right? If we have any live questions on the live feed, I certainly can take some. And obviously, if there's anything that you think about after the video, after we're off, you can send them in, and we'll do our best to answer any of those as well. if I apologize if we can't get to all of them. We certainly do our best to get to as many as we can. Well, listen, I appreciate everybody being with us today. And I implore everyone to stay safe, and we will be doing this series as this Ask Our Vet series, these live Facebook sessions, hopefully frequently. So we're going to be bringing up various topics, and the hope is as we get through this, we can bring up really pet specific product, things, and really continue a health series and talk about pets. But obviously, clearly, this is the most important thing to talk about right now. So thank you very much, and everyone stay safe. Thanks.